You can always, take cultural competency courses and things like that. But I think there's no substitute for experience, really. And I would even encourage people to seek out friendships and relationships with cultures that are different from theirs. And especially if you have friends who are direct with you and can check you if you say the wrong thing, that's always nice, actually. Because we all have our biases that are kind of built into us. It's important, though, even though we have those biases, to be aware of what your biases are so that you can try to if you just like the awareness of being how you're biased helps. And there's actually online tests you can take to identify your own biases.
I think it's important to know what your limitations are. So when you're in a culturally insensitive place, to be able to say to your patient, who I'm sure already recognizes that this is, your patient can see you very clearly and they will make assumptions about you before you walk in the room in terms of your socioeconomic status, and they can see your race and culture and things like that. They don't expect you to be anything but who you are. If you're in a situation where you feel like this is not a cultural milieu that you feel comfortable in or that you're well versed in, asking your patient how they would like you to approach certain things. I work with a lot of conservative Muslim families, young women who will come in who are covering their head and covering most of their body. And I have to ask them, do you feel comfortable with me? Or what's the most comfortable way for me to examine your ears that have been covered? What's the most comfortable way for me to listen to your heart or to your lungs? And most of my patients just appreciate me asking the question and can give an answer. Sometimes you can collaboratively decide, like maybe, for instance, if I'm seeing a young woman, to say maybe it would be more comfortable if you see a female provider next time, that's an option that you can give if your practice allows you to do that. But often I think when you're in situations that are uncomfortable because of cultural differences, to just allow your patient, to empower your patient to help direct you, and acknowledge the ambiguity that probably both of you were feeling before the interview even began, before the conversation even began.
There is a disconnect between, I found between my background, which was sort of working class, suburban, and my patients. And I've enjoyed privileges, even though, my father didn't go to college, but I was able to, right? Because they were working and provided a fairly stable home and believed in the value of education and things like that. And so you may have patients who don't come from backgrounds like that, and that's okay. You can't change your background, and you can't change theirs. So the only thing you can do is to, be open to what the patient's saying and really listen to them, and to check in with them also about well, how can I best help you? And I think, if patients are, in general, that I found have really responded to if you're genuine about wanting to help them, and if they are seeking help and want that help, then they'll let you do that.